when you call to get your car fixed and say, hey, this is Dr. Tory, the chiropractor, because you're proud of that. We can be proud of our profession. Well, I think there's a lot of chiropractors who feel like second-class citizens maybe. They're not proud of it, so they try to make up for that by doing other things.
See, what we have to do, and I don't want to sit there and say, you need to do this and you need to do that, because I'm right there with you. We're chiropractors. Okay, we're in the same game. We're on the same team here. But what we have to do, but I'm kind of directing it at you, is we have to really embrace the whole cool outlaw thing of chiropractic. I love that.
Yes.
Okay? Chiropractic and people's ears perk up, positive, negative. I love that. I love that we're just not this mundane, boring, benign profession. I love it that we've got some fire and some spark, and we've got opinion, and we've got opposition. Okay, that's what makes chiropractic so great, especially when you know that you're right. You're right. And when you know you're right, I had a thing the other day. Someone sent me a copy of a podcast. This is one of the most popular podcasts in the world, 1 million+ viewers. This guy who does this podcast can get anybody he wants on there. He can get any rock star. He can get the head of NASA. He can get big-time people on the podcast. And he had a rant where he was anti-chiropractic. And people send me things like, what do you think about this? Like their feelings were hurt. And I just sit back and go, well, he can have whatever opinion he wants.
Yeah.
It's his podcast. If he likes chiropractic, great. If he doesn't like it, fine. That's his choice. He didn't meet Dr. Wilmot. He didn't meet me, and maybe he didn't meet you. But so what? I sit there and say, well, if he hung around me for 10 minutes, he would change his mind. The experiences he's had chiropractically weren't that great. He just happens to have a big voice to a lot of people, and he can express it. What are we supposed to do, get mad at him and not like him now? I still like the guy. I'm still a fan of his. He just has an errant opinion because he's never been exposed to real, powerful, principled, philosophically based as the foundation, chiropractic. Fine. And I'm okay with that. It'll spark some controversy and some. Is it going to make, people aren't going to come and see me because he had this bad stuff to say? No, that's his opinion. And it's too bad that he's off because, I've had tires blow out. I've had accountants make a mistake, but I haven't thrown out accounting and I haven't thrown out tires. And he's kind of doing that with chiropractic, but that's okay. It's his opinion. You have your opinion on chiropractic and you're entitled to it. We have ours. These people have theirs too. Fine. I love this whole thing that keeps chiropractic a little edgy. I love that about chiropractic, and I'm excited about it. I embrace it, and I recommend everybody else do too.
Yes, and it shows that you're excited about it. And I like that.
Of course, I'm excited. I'm okay. I'm excited.
And when you speak of someone like that who has these different views or opposing views of chiropractic, I'm going to bet 9 times out of 10 it's because they've heard a limited view of chiropractic. And it goes back to your analogy of that depth of understanding, because if you have a shallow depth of understanding, well, that's the chiropractor maybe who thinks chiropractic is just for neck aches and back aches. That's this shallow understanding. And I think opposition gets created because there's so much competition in that world where they can maybe look at that as it is a medical objective. If your goal is to treat a symptom, you're now in the medical world. There's all these other competing things with that. But as our depth of understanding changes and increases, now we get to this point here where we see chiropractic is not the treatment of any symptom or disease, but it's for everybody because it's about life expression and everybody can benefit from that. And now that's an opinion, or not an opinion, but a point of view where people can look at that and go, that makes perfect sense. And of course I would want to do that because it's very logical and there's really nothing to argue with down here. That's what's so great about it. Up here, yes, lots of argument because now we're competing with everybody else. Down here, nothing to argue about because it's very logical and it's something, again, that everybody can grasp and get and see the need for.
Yeah, that's exactly it. Is people, if you're having a conversation about what the best way is to treat a bulging disc, well, then we're just like another treatment thing in that whole mix, and it's easy to get caught in that. Okay, and does it happen that chiropractors give spinal adjustments and it does give relief to people and it does, say, possibly diminish, increase mobility? All of these cool effects happen, but it's that, why are you doing that? Okay, it's like nerve flow, nerve flow, nerve flow, nerve flow. And even then, we don't have any control over that. We deliver adjustments. We have a trust, we have a faith, we have a belief that the body's built and designed a certain way and it will respond accordingly. boy, beyond that, we're out of the game. And so you're exactly right. When we really come from that mindset of I give adjustments, nerve flow, hey, all these cool things can happen. If it does, great. If it does to a great degree, great. If it's a miracle, great. If you don't really feel that much better, well, you're still better off, because we really have no idea what the decade-long effects are of chiropractic. For all you know, we give adjustments today, and they're completely changing the course of where that person was going, and we have no idea because we didn't see a symptom relieved today. Chiropractic always has a positive benefit unless you really, really are hacking on people and making a mess and not paying attention. So, yep, the principle, why are you adjusting people? What is your objective? And that's what Strauss is so good. He loves the word objective. I was just listening to that talk with him. Of course, behind him there's nothing but walls of books, as you would expect from the great Joe Strauss.
Yes, yes. Now, you were saying earlier how from the start, really, you were centered on something. So that seems to be the key there. We need to be centered on a premise, a principle that's logical, makes sense, which is the objective, straight chiropractic principle. So if a chiropractor isn't centered, what do you say? How do you get them back on there? What do we do? How do we help pull them back to a center and have that place to start from?
Well, I think of two different chiropractors here. I think of a chiropractor that's really struggling.
Yeah.
They're just not able to get traction, can't get people to come in and see them, aren't really making good recommendations to people. Realize if you have a patient come in and you really don't tell them the truth of what it will really take to get better, I mean, is that negligence? If you went to an emergency room and you had something and needed 40 stitches and they said, well, maybe we'll just try a couple stitches because I don't want to say any more than that because maybe you can't afford it and I don't want you to not like me.
Right.
Think about that. So we have the chiropractor that's weak. Okay, this chiropractor, once they really bite into and get the chiropractic philosophy and principle chiropractic bug, and this doesn't mean you go and read a bunch of green books and you say, it just means you understand it and then you start to apply and do things from that framework. There's that chiropractor, and we can really make big changes here. But we might have another chiropractor over here that maybe is doing okay financially. They're paying their bills, maybe they're saving some money, they got a toy or two, they think they're doing all right. But they're really doing it, and they're actually making more money on therapy than they are from chiropractic. And their patients really don't know what they even do. What does Dr. So-and-so do? Well, I don't know, I go in there and this happens and that happens and this person comes in and does this and they hook me up to that. And they really don't know what the person does. In fact, they don't even identify that person as a chiropractor. And by the way, when a patient calls you a chiropractor, do they know what a chiropractor is? See, you're centered around something. So when I hear the word, okay, this is a good point. If I hear the word chiropractor, it means something to me. I'm thinking highly trained person, spinal adjustment, subluxation, nerve flow, brain into the body, 100% for life, high perform. I think of this chiropractor thing. Mm-hmm. It just occurred to me as we're talking here that I think other chiropractors, when they hear the word chiropractor or when patients hear the word chiropractor, what do they think of? What do they picture? And it's our job and our practice to have people understand what a chiropractor is by, number one, being the real thing first. Yes. Talking about how you just got adjusted, seeing your family get adjusted, seeing the girlfriend come in, the boyfriend, the husband, wife, the kids, the mom, the dad, the friends. Okay, come in and get adjusted, and just seeing that. When your patients see you in that environment and they see all these other people, they'll naturally follow what's right if you just show them the way.
Yeah. So that's an important point right there. We need to create an image in the minds of the people coming in to see us. We have to, when we say chiropractic, it has to mean something, and hopefully it means a thing that we do to allow life to express itself in their body. And I think a lot of chiropractors, they kind of get frustrated because, well, no one gets it. I'll have these people that come in, they complain about symptoms, they complain about headaches and backaches. Well, it's because that's what you've told them. That's what you've told them chiropractic is. So you get what you tell people it is.
Yeah.
So we need to start telling people what it really is.